Charlottesville Inside Out is made possible thanks in part to its patrons, committed to supporting the people, places, and quality of life that uniquely define Charlottesville and its surroundings, and by viewers like you. Thank you.
We wear a lot of masks as men, to try to fit in. What we try to do is to try to encourage guys to take the mask off and get comfortable with who you really are.
They stick to their role, we stick to our role. And it is a little weird. Sometimes you kind of wonder, oh, that's right, we're just acting here.
For WHTJ, I'm Terry Allard, and this is Charlottesville Inside Out.
You don't really see fathers these days, in their child's life, or if they are, they don't shine no light, So I'm just here, for all the real dads out there.
Today we're going to talk to a mentor in our community who works closely with fathers, some who are incarcerated, to support them through challenging times and help them to be better parents and partners. Join us as we catch up with fatherhood specialist Eddie Harris from the Ready Kids Real Dads program. Come on.
The Real Dads program is a fatherhood program that focuses on guys that are incarcerated or coming from that extreme type of a lifestyle. And what we offer is support and resources to guys in building their relationships with their children as well as with the mothers of their children.
So how does it work? How does it work in the prison, and how does it work here in the community?
Well, in the jail we do a weekly group. And we have a small group at the jail so we can keep it more intimate and more trustworthy. And guys can request our program in the community by just simply getting in touch with Eddie Harris at Ready Kids.
Let's talk about in the jail. What happens in the program? What do you do?
Well, what we basically do, we have a curriculum that we use. It's called Inside Outside Dads. It's from the National Fatherhood Initiative. Mm-hmm. And we use that as a basis or a foundation for the work that we strive to do in the jail. And once we get guys to kind of like focusing on themselves and being willing to talk about themselves, what I try to do is to create an environment where guys feel comfortable talking about what their challenges are, what their difficulties are, even what the things that they do very well are, and just building that environment where guys can just feel comfortable about what keeps me coming here.
Right.
Why am I here now? How can I do life better? How can I become a better father? Because the solution is definitely not within me. Their solution is within them.
Well, and this is such an important need in communities and in our community. I mean, talk about that. A lot of these guys never had a dad of their own.
Well, I think what I found out is that, Terry, a lot of guys have never had anybody to really listen to them. Mm-hmm. So, it gives them an opportunity to express what's important to them, what their likes are, what their dislikes are, and hopefully the environment or the atmosphere is one that you won't be judged by whatever your thoughts are.
Right. So that's a big deal for you to build a relationship so that they feel that they can do that, because their past has never really made that possible. So talk about how important that relationship is.
Well, relationships I feel like are at the core of everything that we do. Mm-hmm. Relationships, and I think that guides the processes. So what I strive to do is to share with myself, talk about my challenges, talk about what my difficulties have been, talk about my missteps, so they feel more comfortable speaking about theirs.
Right. You did make some mistakes in your youth.
Sure, of course. May not came from extreme circumstances, but made some decisions that put extreme circumstances in my life.
Yeah. But now you've turned that into something that's very positive for other people. And then when you're talking to these dads, they do trust you because you're not making it up. You're not pretending to understand something you couldn't possibly understand.
Sure. And what I'm learning is that I may just be the guy that plants the seed. I may not be the guy that waters it. So in every situation, I try to look for, okay, what is my situation with this particular man. I don't look for one blanket to cover all these guys the same way.
Yeah.
So even though we're in a group, I still deal with them as individuals. I try to see what it is that's going to take them to go a little further.
Yeah.
I was first introduced to the Real Dads program when I was incarcerated at the Albemarle County Charlottesville Regional Jail. And I just wanted to figure out what it was about.
Kids that have absentee fathers have higher rates of poverty, have higher rates of teen pregnancy. They often have substance abuse issues and end up incarcerated themselves. And what this program does is it stops that cycle.
To me, what informs everything we do is community safety balanced with the fair treatment of offenders. And one of the things that Eddie's program really helps us with as prosecutors is the fair treatment of offenders part of our job, so that we can transition them back into the community and help them be productive members of the community, which is what they all want.
So we've been talking about the importance of building relationships with the dads, but you've also been building relationships within the jail with the staff. Talk about the importance of that and one of the really great outcomes of those relationships.
Yeah, well, you know, taking the opportunity to build relationships is invaluable. So in the process of building relationships with the staff at the jail, we've gotten the opportunity to have the kids come in quarterly and meet with their fathers on a contact type of a visit where they can come in and play games. We also have structured events for them. You know, they come in, take pictures, make picture frames and different things like that. But that doesn't happen without building the relationships with the jail staff, and that's how this thing works, I think.
Talk about some of the different issues that different fathers come to you with.
Well, you know, guys have all different types of situations going on, and sometimes it's multiples. You know, some guys are just insecure. Mm-hmm. Some guys are dealing with substance abuse issues. Mm-hmm. Some guys are, you know, are just fragile, have dealt with trauma through their childhood. Mm-hmm. So that's still playing havoc in their life. So the thing for me to do is, again, to try to build a comfortable enough relationship with these guys where they are trusted enough to go in, you know, and access what it is that's going on with them, what's blocking them, what's holding me back.
You ask them about that, but you also ask them, what are your dreams? You
Sure.
ask them,
what's your dreams?
you know,
What's
how do
your
you
goals?
see a win?
Yeah.
What's that you say?
Well, the thing that I want to ask guys is that, okay, what is a win for you? You know, because a win for me may be different than what a win for Terry is.
Right.
So, and then I want to know, how are you participating in making that win a reality? Because a lot of times when I hear myself talk, I'd be like, oh no, that's not lining up with that. That don't make sense. And that's how we get those crazy results sometimes, because what we're thinking and what we're actually doing, it's not really lining up.
Right, and no one's ever asked you.
Sure,
You know, no one ever
sure.
has ever asked them.
Because it's like,
Right.
if you know, I want guys to be able to make their goals, their dreams, their aspirations, their relationship with themselves a priority. Because, you know, it's no way that I can love my kid more than I'm loving myself. So I have to learn that love for myself, and in order for me to love myself, I have to get a relationship and know myself.
Real Dads is about confronting resentment, regret. It's about confronting, you know, your father if he wasn't there. It's about confronting the father you wasn't. And I know I wanted to be a responsible father.
It's kind of like therapy, you know. It's just very helpful for them to be there and to actually understand, you know, what you're going through as a dad, as a husband, boyfriend, you know.
Coming from these areas, like where we came from, I'm just happy for him, because he could have easily veered off and lived the life that I once lived, a negative lifestyle, but he was a little stronger in his mind, and he's been doing the right thing, graduated, married with kids, so I'm very proud of him, and I'm glad he's still in the program. And you know, I use the same thing that he used. I try to stay with Mr. Harris, and Mr. Harris has been there for me and my son, and it's great.
Why do you do this?
I do it because it's important to me. As a community, as a nation, we're actually suffering from the lack of folks really engaging and keeping the generations connected. A lot of these fathers are like my son's age or younger, you know, so to be able to have some type of an influence in a positive way in their lives makes a great difference to me. It makes me feel like I'm really doing something that's making a difference, because I know good givers are great getters.
That reminds me too, you have a business.
Sure.
You are the co-creator and co-publisher of Vinegar Hill Magazine.
Sure.
With Sarad Davenport. Talk about this magazine and why you think it's so important that the two of you are working together to bring it to the community.
And Vinegar Hill, a lot of people know, was it was an African American community that was destroyed and demolished, and a lot of the culture was destroyed along with the neighborhood. So what we want to do in the essence is like, we want to bring the art plus business equals success equals freedom model to the forefront. And working with a younger guy, you know, I get his goals, his aspirations, and his wisdom, and we get to bounce stuff off of each other. I think that's something that doesn't happen a lot these days, and I think we need more of that, because it's a generational disconnect.
Yeah.
And I think we really suffering from that.
Talk about some of the different writers who contribute to the magazine.
We've had Sonia Montalvo, Dr. George Bates, Maxine Holland, Andrea Douglas does great articles for us. We had Dr. William Harris, who was the first Dean of African American Affairs at UVA. He's written several articles for us.
You're not leaving anybody out. This is good.
It goes on and on and on, and it's somebody that I'm missing. Please blame it on my head and not my heart, because I really appreciate what you've done.
It's a quarterly magazine, and people can pick up the physical version of it at the Jefferson School African American Heritage Center, and then there's a digital version.
Sure.
You say this work with the magazine and your work with Real Dads really connects to one another. Tell me how that works for you.
Well, we always talk about we want to make a better life. And I'm always thinking about, I would like to see something better. So the deal is, if I want to see something better and I'm not seeing it, create it. Do your version of it. So we get these people to write these articles, and they have something to share with the community. So we work with guys in Real Dads. They have talent, they have skills, they have something to offer this community. And if we just keep on shelving them and keep putting them in those boxes, they'll never get a chance to share it, and we'll never get a chance to benefit from it.
Right.
So do we really have the luxury of throwing somebody away? I don't think so.
Me being, financially stable, me having a stable home, me, being with my kids, not being stressful, that's being successful to me. And that's what I tell Eddie that I wanted to be.
He's always been a great mentor to me, and always been there for me when I needed his help.
When I left from out of that jail, I left out of there with a sense of hope, with a sense of faith, and I had something inside of me that was pushing me to be ambitious towards my goals.
Come in. Today we're going to hear about a program at the UVA Clinical Skills Center that teaches med students to better connect with their patients. As part of the curriculum, community members are trained to portray a variety of patient scenarios, giving students the tools they need to be competent and compassionate doctors. Join us as we learn about the Standardized Patient Program. Come on.
The Standardized Patient Program is really critical to helping health professions students. We're here in the School of Medicine, but I do want to share that we actually work with students from other health professions as well. And it's critical because so much of training to become a health professional is in the clinical environment, which can be very unpredictable and actually unstandardized. And so standardized patients actually give us an opportunity to teach skill development and also assess skill development in a much more standardized way.
So how do you go about doing that? What exactly happens?
So we recruit standardized patients who are just normal, everyday people from the community. They come to us, we train them to portray a particular patient, and they'll either work in a teaching scenario with the student, or the student might be learning how to do a heart exam or how to take a history on a patient with chest pain, something like that. And we also have them working assessments where we're actually able to test whether or not the students we're sending out into the world are actually able to, work as diagnosticians and clinicians.
Why is this so important? It has proven to be such a great program and such a necessary program.
What I think is most valuable about it is that it's really the application of knowledge. You can read, this is what a patient looks like when they're coming in with a heart attack. But if you see a patient and it's chest pain, is it a heart attack, is it something else? How do you work through that? How do you diagnose your patient? And also, how do you talk to them? If they come in and they say, I'm scared, what's happening to me? Am I going to be okay? That's not something that always comes naturally. That is a learned skill, your bedside manner.
Yeah.
And I think it's that opportunity to learn in a safe environment that allows students of all kinds to feel more comfortable, really trying to apply the skills that they've learned in a classroom or a small group setting, and being able to get feedback from their teachers. And I would say the standardized patients are part of that teaching team.
Yeah,
so
definitely.
Our standardized patients do help students learn about how they're communicating information, how they're even their body language during an interaction helps the patient feel more or less that they're engaged or comfortable with the encounter as the student is really trying to really learn the role of the health professional.
Right.
Well, and give us some more examples of what they might encounter.
Sure. So you might have a young woman with a severe headache, and you have to bring her out of her shell and recognize that she's in a lot of pain, but still get the information you need. You might have an angry patient who's been waiting for 45 minutes, and you have to figure out how to navigate that. As Mary Ellen said, dealing with other health professionals, what information do they need from you? What information do you need from them? How do you treat each other, respectfully in the professional environment?
And I think, so really what drives the selection of what types of patients is our curriculum.
Right.
And I think part of the communication piece, so after the encounter, there are other components of these activities where students are learning how to do an oral presentation to a member of the healthcare team, or write a note that would go into the electronic record so that, again, other health professionals caring for the patient that they just saw would understand what the patient's context is, situation is, complaint is, and what the patient needs.
Come in. Hi, Mr. Smith. My name is Richard Bayless. I'm a third-year medical student, and I'll be talking to you today.
Okay.
How's it going?
All right. My back has been hurting.
Gotcha.
It's a lot like acting in theater, but it's much more intimate because you are actually interacting with another human being in time and space, like together simultaneously.
If the students are actually supposed to be figuring out something like a diagnosis, you have to be really sure you've memorized all the symptoms pretty specifically.
It's really fun to see sort of, the nervous first year with maybe shaky hands with the stethoscope, or, they have pauses, they don't really have it all down yet. But by the fourth year, they're so seasoned. I mean, they're diagnosing, they know how to do things in a set amount of time. It's just kind of fun to see that progression.
So the patients are simulating heart attacks or chest pains. I mean, almost everything that you could encounter, right?
Yeah, everything from headaches to toe pain.
Yeah.
Oh my gosh.
So it's really looking at all the systems of the body, and again, looking at what are the students learning in the curriculum, what are the either common conditions or typical conditions that we want them not only to identify but be able to distinguish from other common presentations. And I think that's a key aspect that Laura talked about. It's that reasoning process. Again, not just obtaining information or giving information to a patient, but how do you use that in learning how to work through, diagnostically through a case to figure out what the patient wants, what the patient needs, and how best to come to a shared understanding about that.
Yeah, and there's so much more involved, in diagnosing something, and the steps you take from there.
Right. One of the very first things they do actually is a simulation with where they think they're just learning about something, and then a standardized patient runs in the room and says, "Help, help, my husband has collapsed."
Yeah.
You know CPR. come help me, and they have to run down the room and do CPR on this man. So yeah.
And I think that scenario shows how we work with other technologies in simulation too. So that actually takes advantage of our simulation center and the mannequins, but the students really start through an interaction with a standardized patient.
Right.
So the students actually work with standardized patients throughout before they go into a clinical learning environment in a course that's called Foundations of Clinical Medicine, which is the first 18 months of their medical school. And importantly, the other aspect of this is we're preparing them also for a national licensing exam, which actually also uses standardized patients.
Well, and so what has the response been from students? How do they feel about the program?
I think they really enjoy their time down here. I think that, as I said, is it's a chance to apply what you're learning. You know, you can get kind of swamped with the books, and then you can come down here and I think maybe remind yourself, oh yeah, this is why I came to medical school, right? To see patients.
Do the students ever get stumped when they're trying to diagnose a patient?
So really the goal is not to trick a student.
Just in that first day.
But rather to prepare them well. So when we have a case that doesn't go as we intended, we do a lot of really debriefing among the team to say, what information did we not provide in the case? What were the questions we were asking the student to be able to do in this scenario? So the goal is not to find some fascinating case that they'll never encounter as a clinician or to pull out that trick diagnosis. The goal is to write a case that's as authentic as it can be. And then again, meet the expectations, because as a School of Medicine, we have expectations that we want to ensure for all of our patients, that our students are ready to do these things.
All of these examinations are filmed, which gives us the opportunity to see ourselves through someone else's eyes. And it also shows us how we behave under pressure.
So let me have you just lie back here. Sure. You come into a patient encounter room and you know that it's a case, that it has been pre-written and that this is an actor. But these standardized patients take it very seriously, and oftentimes you'll have a very real human interaction where the patient may be going through a very difficult situation, and you have to be able to show empathy and understanding.
They all have like different ways that they kind of play themselves, and it's really good practice getting to kind of experience each of those ways, so that when you do get out in the hospital, I felt pretty well prepared because of that.
Who can be a standardized patient?
Anyone.
What are the qualifications? Anyone.
I think our youngest SP ever was, I think, 6 years old. Yes, and our oldest is about 85. So yeah, anyone. We tend to attract a lot of people with a background either in drama, in the arts, or education, and also actually a lot of retired medical professionals, nurses, speech pathologists, but we have SPs who are stay-at-home moms. One's a beekeeper. So it's
And talk about the training, because they receive, you know,
very
significant training.
Too. Up to 16 hours training each patient to go into the room and interact with the students. And a lot of that is sort of, you know, what if, because no one has exactly the same interviewing style. So.
Right.
And still the standardization is important, because you can imagine we want every standardized patient who's portraying a case, a patient with certain characteristics, that each student group that has that experience is having the same experience.
Right.
And then for assessment, for sure, we want to be applying the same criteria for all students.
Right, that's the word, standardized.
Right.
It's very, very important.
Right.
Exactly.
And Laura, so what really makes a good standardized patient?
I think that some of our best standardized patients are people who are really great observers. They can kind of simultaneously, you know, retain all the facts of the case, watch the student to see kind of what behaviors they're exhibiting that are either successful or less successful in developing that patient-doctor bond. And then they also have to kind of self-observe to discern how they're reacting to the student so that they can give them meaningful feedback.
And a lot of what we ask the standardized patients to do is give feedback about, again, students' emerging communication skills. And I think they bring their experience not only from the training, but as human beings and as patients to help students understand, again, whether the way the words were said or the body language may have not conveyed empathy, an understanding, an openness to the patient's concern. As you know, we're trying to ensure that students understand the importance of that shared relationship in a patient encounter.
It can't just be about science.
Right, that's exactly right.
Exactly, it can't be.
This is really one of the few places that they can hear, here's how your bedside manner struck me, you know. When you said this, when you put your hand on my knee and said, I understand you're upset, but we're here to help you, that really made me feel comfortable.
Each and every time you go in there throughout your medical education, you actually see yourself becoming a little less clueless, a little less nervous and unsure, a little more competent and a little more confident. And over time, you start to be convinced that maybe one day I'll be somebody who knows what they're doing, right?
There's just something wonderful knowing that you were kind of part of that learning experience. You've given them feedback, and you feel as though they're going to be the kind of doctors you want to go to.
That's it for this week. For WHTJ, I'm Terry Allard. Join us next time on Charlottesville Inside Out.
Charlottesville Inside Out is made possible thanks in part to its patrons, committed to supporting the people, places, and quality of life that uniquely define Charlottesville and its surroundings, and by viewers like you. Thank you.